And it's my last question, and that is, what should happen next?
If we are to learn lessons from what's happened in the last 16 months, I think the biggest lesson that we need to learn is we cannot live with this. I think the question of living with the virus and acceptable deaths, because when you're saying deaths are acceptable, I think you have to ask yourself, why are they acceptable? How many deaths are acceptable? And who are they acceptable in, and who will they happen in? And the fact is, a lot of, I think our government doesn't care about acceptable deaths because they're in vulnerable individuals, they're in ethnic minority groups, they're in key workers, frontline workers, they're in, people who live in deprived areas, and people who've been left behind. They're in the disabled, they're in the homeless. And frankly, as a society, we can't accept that, and we don't have to accept that. There are the models out there that show us that we don't, and every single death is preventable. And it's not that it's coming at this huge economic cost. It's very, very clear that countries that valued life, that treated deaths as preventable, are the same countries that have done best economically. I mean, people who think that our pandemic strategy has been a success should look at the number of deaths, the number of people suffering with long COVID, but also the impact on our economy, on the fact that we've been in restrictions for, 16 months, 3 lockdowns, 4 months of children being out of education. How is this even remotely a success? So if I would say we need elimination along with vaccine rollout, and that is completely achievable. What we need to do to achieve that is essentially, first of all, lay down a long-term plan to the public. It can't be change restrictions for 4 weeks, lockdown, this ad hoc chaotic communication. Clear public messaging. What we need is to fix our broken test, trace, isolate system, put it in the hands of local authorities who know how to do this, who know their communities really, really well and can work with them, support people with isolation. There's absolutely no point putting in billions into tests if only 1 in 5 people with symptoms are coming forward for testing because they don't have adequate support with isolation. We need to have a comprehensive quarantine, managed quarantine and supported quarantine strategy at borders to prevent new variants coming in that could really threaten our pandemic response and our vaccine effectiveness. And we need to bring transmission right down. And a big part of that is going to be mitigations in schools and workplaces. We need to invest in infrastructure and ventilation in places for the longer term, not just now. This is going to have long-term benefits for health, even post-pandemic, if we get to post-pandemic. But we need to focus on containing aerosol transmission. We need we need to supplement ventilation in schools, in buildings, in workplaces. We need masks for children in schools. And we need, once we bring transmission down, to keep transmission down. So we need to have rapid surveillance whenever there are little outbreaks here and there and prevent them spreading into the community. The problem with allowing high levels of transmission with vaccination is that it's really, really dangerous. There's very good research that shows that that's the exact situation in which adaptation towards escape happens, and escape variants are much more likely to become frequent in the population. And that is exactly the position we're in right now.